Hi, and welcome to the Healthcare CEO Show, where you'll find actionable insights on healthcare leadership from the best and brightest in the industry. I'm your host, Daniel Fernandez. Let's get a pulse. This season, we're going to be talking about the intersection of M&A in the healthcare industry. And there is one hot topic that is top of mind for a lot of healthcare professionals, and that is recruitment and retention. Today, we're going to be talking to Clay Jones. He's a Chief People Officer at Legacy Hospice. Clay, welcome to the show.
Thank you. Excited to be here.
Now, before we dive into the recruitment and retention, tell me a little bit about how you became a Chief People Officer.
Well, I've been in healthcare for about 22 years. Spent most of my time in the human resources element of that. And about a year ago, the title changed. So we moved from Chief Human Resource Officer to Chief People Officer. I actually came to Legacy from working with hospitals and healthcare organizations for about 20 years, and Legacy was a dynamic company that was looking to grow, and I saw it as a great partnership.
Now, what specifically drew you to the hospice space? I would say that maybe we'll talk a little bit about that, but it's not a common space that everybody would sort of gravitate towards initially, at least.
Yeah, and I was hesitant at first as well. I've spent most of my time in all the other areas of healthcare, and hospice is such a smaller, segmented section. At first, I was shied away from it, but then I heard about what the Legacy's mission is. They specialize in hospice care in rural communities, and I've spent about the last 12 years of my career focused on rural hospitals and rural hub and spoke models where I've worked in rural communities and serving that critical population. When I heard the Legacy story and their quality, I saw it as a great fit.
Yeah. Now, working in metropolitan areas comes with its own set of challenges.
Correct.
But working in rural areas, of course, even more so. What are some of those challenges that you faced working and living in a rural area?
I would say one of the biggest ones is population density. When you start looking at the population density, you're also looking at the number of payers, and you're looking at finding both patients, but you're also looking at finding employees. And from a Chief People Officer aspect, when your primary business is a service one, it keeps you focused. It keeps you on your toes.
Yeah. Do you feel like, there's a competitiveness in the metropolitan areas? Do you feel like there's that same competitiveness and even in the rural areas as well?
I would say since COVID, we saw such a decrease in the market. A lot of rural communities were already stretched on talent, and we saw an increased retirement push. We saw an increased basis of people stepping out of the field, and it already took a compressed market to even a more compressed talent pool.
Now speaking specifically to the hospice space, what are some of those common misconceptions that people may have about the hospice space in general?
I think the best ones are, it's not that attractive from the outside. So when you're thinking about your healthcare career, you're thinking about, recovering people, getting them back to living, back to moving, and hospice is the opposite of that. And from that standpoint, we are talking a lot of people into a career in hospice because of that, because they haven't ever thought about hospice being a place where they can really grow their career, expand to actually provide great quality care while making an impact.
Now, being a private equity backed or financially backed multi-location practice, you've got some growth considerations as well. What are some of those considerations when you're looking to grow, a practice?
Well, I think the primary one that we face is looking at where we can provide the best care and where it's underserved. We do a lot of market studies to make sure that when we're entering a market, we're entering a market that needs us and that we can actually best serve our patients and our population.
Now, a conversation about recruitment, if you're going to have one, you obviously have to talk about retention as well, because if you hire 10 and 20 leave out the back door, well, that's an even bigger problem, right? So, how do you maintain that culture that keeps and retains your top talent?
Well, I would say that's something that we're it's a continual focus. You can't stop looking at that. It seems like once you figure out a mix that works, your competitors figure out that same mix, and then it becomes harder to keep talent. So I would say we are focused on developing our leadership. We're focused on bringing talent into the organization that has a real alignment with our mission and our purpose. And if they haven't aligned fully with that, we spend a lot of time cultivating that early on into their tenure with our organization. Because you can tell very quickly whether an individual is in hospice for the right reasons, and whether it's where they can see themselves being in a career, or if it's just a temporary season for them.
Yeah, it's hospice seems to be more of the personalized care, type of practice. Are there things maybe you look for on the recruitment side that, may be prevalent in some of your top candidates that
Yes.
maybe would be a little more important than other aspects of healthcare? Like, for instance, if you're hiring for an ER, for instance, they might not necessarily be the same they might not hold the same personality traits as someone who's looking to work in hospice care.
Absolutely. I would say that nursing is a very broad field, and having worked in hospitals and clinics and all those other areas, when I first walked into hospice, I assumed recruitment would be the same. And I found out very quickly it wasn't. I believe we've pivoted our model at least 2 times, if not 3 times. My recruitment team has changed pretty drastically. I would describe us as hunters. We are not gathering resumes of people coming in the door. We're out hunting for talent. And I would say one of the things we look for is a nurse that's willing to work at the top of their license, that wants more autonomy and freedom. Hospice is primarily a home-based care model, so meaning that individual is on their own. They're providing that care in the home, and so we're looking for individuals that are driven that way. A lot of times we do find an ER nurse or a flight nurse or an ICU nurse that loves the complexity of care and the broad scope of care, but wants more control and more autonomy in their career, and hospice gives them that. Hospice gives them the opportunity to truly expand past the walls of just care, but actually get into psychosocial and spiritual care and being over an interdisciplinary team. It just really is a different area of healthcare. And I figured that out really quickly, thank goodness, and have found it to be really an amazing area of a very small segment of healthcare that allows you to just provide a lot of care for a small amount of dollars.
So you spoke about autonomy. Do you feel like autonomy is sort of becoming more of a differentiator just because maybe, in a hospital environment, you have less of it, and maybe in an in-home care instance?
Yes, I would say that from spending 20 years in healthcare, I would call healthcare very doctor-centric, with nursing being right there with them, but very doctor-centric driven. Hospice is very nurse-centric driven. It takes the nurse's keen eye and development of those patients and seeing where they're at, seeing where their emotions are at, seeing where their feelings are at, and then being able to work with another 5 to 7 professionals in conveying that level of care. So it really is something that a nurse needs to be able to spot a wound that may be exacerbating, or a cancer patient that may need increased pain medications, and be able to consult with that doctor as a professional to provide the best care for those quality of life days that we're looking to extend and provide for them and their families.
Now, looking ahead, it's no secret that there's a shortage of healthcare providers and caregivers nationwide. This is no secret. We're not divulging anything that people aren't already aware of.
Right.
How do you foresee overcoming those challenges in the future?
Well, it is a challenge, and having been in healthcare for 20 years now, we've been talking about this challenge, and we know that COVID definitely sped up the challenge. It increased the speed of retirement. It increased the focus. We're doing like many organizations are in healthcare. We're looking at split shifts. We're looking at bringing those that want to stay in the field. We're looking at preceptor programs and driving that talent that is leaving the field to stay in and engaging in other ways. But I would say that it's something where we're actually focusing at the start of the education loop. We're looking at our early career professionals, we're looking at those in school, we're looking at those that are looking into schooling and talking with them. The nice thing is the communities we serve, as we become a more integral part of that group, then we're focused on finding ways to connect them to the hospice profession, even at the volunteer level. You know, starting a student as a volunteer in hospice and then allowing them as they're deciding on a college career to see that as an option, and then aligning them with scholarship opportunities and growth within the profession as an aide and then a nurse and a professional. Those are some of the greatest stories we have. So I would say we are sourcing from every avenue that's possible, including those that have lived through hospice themselves. Most of our professionals that have been with our organization have had a loved one that has chosen hospice, and now they see the true value of it as well, and it becomes a heart mission.
Now, you talked a little bit about, recruitment fresh out of school, and of course you've got nurses that have been in the industry for decades. The boomer generation was one of the largest, if not the largest generation ever, and with that, a lot of nurses. So is there more of an effort to try to retain some of those boomers and, keep them on board maybe a little longer than in the past?
Yes, absolutely. Looking at models where they can continue to care, still provide that amazing care for maybe a lower amount of patients or a lower caseload, looking at part-time negotiations and processes, looking at on-call and triage teamwork, things that they can truly be a part of the care model, but provide that sage moment, that preceptor level experience, that leadership experience that we don't want to lose. And I would say that our industry does trend to a more experienced nurse because of the scope that they deal with and the autonomy of the career, but that we are really focused on encouraging people not to leave the profession.
Now, looking at the hospice landscape as a whole, nationally, what are some of the biggest changes you foresee in the industry?
Oh yeah. So hospice is, I like to call them like the enrollee teenager of healthcare. I mean, hospice has only been around 40 years. So from someone who came from working with hospitals that had been around 90 years respectively, and then coming to hospice, it's a very young field. And as such, it has a model that's very contradictory to the rest of the industry, but it works. I mean, you look at the data and we save 15 cents on the dollar for every dollar we get. So meaning anytime CMS gives us a day of care, we're saving 15 cents on every dollar given. And just looking at the outlook over the next 8 to 10 years, the hospice field is set to double in size, but still only represent about 0.5% of the total spend in the US. So it's such a small part. But as we talk about the boomers and we talk about the other generations that have went past them, as we talk about them moving into that possible stage, some of them, one of the things that we are set to see is 10% of CMS is supposed to be spent on end-of-life care. That's a huge percentage over the next 10 years that's going to develop. And hospice being less than 1% of that, but even doubling in size by that, it's a number that's staggering to think about. But it's something that's exciting from the standpoint of how can we continue to develop models that provide that holistic care. I think the most exciting part to me about hospice, and I know I'm tangenting a little bit, is the fact that for the same dollar you're getting a qualified nurse, you're getting aides that come into your home and help with care. You're getting a spiritual advisor. You're getting a social worker that is talking about psychosocial aspects and working with your family. I mean, that scope is unheard of. And the way we're able to do that is just something that I'm excited to see continually grow.
Yeah, no, there's been a lot of interest from investment firms in, the hospice space, especially in the last few years. And I don't foresee that slowing down at all. Do you think that even that is enough to care for, our aging population, or if there's it's just like we need exponentially more investors and growth in this sector of industry because of the need.
I think that in every marketing study we've done, most of our populations are underserved. And it is something that keeps us up and keeps our organization focused on growth. And when you think about the industry itself is supposed to double in size in the next 8 years, but yet we still only represent less than 1% of that 10% spend, I think it's really an important thing to think about. I mean, one of my favorite aspects is coming from the hospital side is seeing how hospice partners with hospitals. The fact that we keep from having readmissions, we reduce ER visits, we're taking that care off of the hospital, and I can see that in the future that's going to continue to be a burden for hospitals, and it's some way we could really partner and provide continued growth.
Now here's a more personalized question. The hospice, you give so much of yourself day in and day out. How do you balance the needs of or demands of managing people and expectations from investors with, the emotional aspect of these caregivers who are, day in and day out and providing this care? And
it's a hard balance. It's a very hard balance, but as mentioned before, I've been in healthcare for about 20 years, and it's the changeover of life, death is always a part of healthcare, but in hospice, it's a daily, weekly reality that's occurring. And what I've seen is the true nature. I've met nurses that surprised me how positive they were. Surprised me about how they live their lives. Because when you're dealing with people that are transitioning out of lives and they're looking at people that have 17 days left to live, there is a passion in these nurses' eyes to connect them with their family, to provide their family realistic timelines and saying, look, I'm seeing you're seeing your mom going here, and your mom's got about 72 hours left, and being able to walk them through that journey with them is an amazing thing. And then I turn around and I meet these nurses that are passionate about their own lives. I watch them as they're passionate about their kids' softball games, and they just have a great time as a group, as a party. They're truly living because they're taking every day and making it count. I think at times we all seem to get into I'm going to work my 30 years, I'm going to get ready for retirement, and life seems to fly by. And I've met professionals in this profession that just live their days fully because they're living on with other people's stories in their minds and in their hearts. It's a compelling area of healthcare.
That's amazing. What advice would you, as Clay Jones, give someone else who's listening to this show right now? Advice on that may be facing what seems like at times insurmountable challenges. Yeah. And maybe just words of wisdom that you would give them.
Well, we have I hate to use hospice as an example, but we had a gentleman that came onto our organizations about 10 years ago as a volunteer. And the gentleman was a veteran and had been through a lot. And he has volunteered with us through our veterans program, helping other veterans walk through their last days of life. And it has brought him out of his shell. It has brought him through things that even others that have been around him didn't believe he could work through. There is a healing aspect in when you're walking through someone that may be in a perceived worser state than you, or perceived shorter time left on this earth. It allows you to put things in perspective. And so I think that, yes, absolutely everything we do is focused on, providing that psychosocial and that spiritual care that we all need in different stages and different places of our life. But learning from your neighbor, learning from those that are above you and behind you in your journey in life and connecting with them. I think of the book, it's Tuesdays with Morrie, and I've probably read that book way too many times to count. It's 88 pages, you can read it in an afternoon. But it reminds you to focus on the cycle of life and where you're at and where others are in that cycle with you. And I think it allows you to step out of your situation and be able to actually look of, wow, how can I impact those younger than me? How can I be impacted by those older or impact those older than me? And I think if I would describe it, I think that's one of the things that's amazing about hospice is it allows you to get outside of yourself and see through somebody else's eyes enough to give yourself some freedom and some peace to breathe and go, wow, I am healthy. Wow, I'm not looking at my family and saying I have 5 days left. Wow, and it changes your outlook. So I guess it's self-serving in hospice to say, because volunteerism is a major part of hospice's requirements. But if you've never thought about volunteering at hospice, all of them are looking. And taking that short time to ride through it with one person's journey is something that I think I could read 2 Steves with Maury every week and not get the value that I would get from walking through it with one person.
I think that's a beautiful perspective, and I think that you don't have to even work in hospice care to appreciate, that perspective. It's a very beautiful perspective. I think it's very easy for people not in the hospice space to get kind of wrapped around the axle and stressed about things that ultimately, at the end of the day, don't always necessarily matter, and they tend to lose that focus. So with that final beautiful statement, I will bring this show to a close, and I do want to thank you, Clay, for joining us today on the show.
Much. Yeah, enjoyed it. Thank you so much.
Thank you for joining us on the Healthcare CEO Show. If you've enjoyed this episode, don't forget to subscribe on your favorite podcast platform for more insights from the top. Until next time, lead boldly and care deeply. See you on the next episode.